You're on.
Pregnancies by and large are normal and physiological, and most of the pregnancies do not have any complications and you don't really need to worry too much. But there are conditions which can pose a threat to either the mother or the child, unborn child, or to both. And these pregnancies are called high-risk pregnancies. So how do you recognize them? How do you be alerted to them? And what do you do when you have high-risk pregnancies? First, let me talk about what are high-risk pregnancies. Now, high-risk pregnancies are conditions which might, if you divide them into two parts, they might be conditions which might be pre-existent before the pregnancy or which happen or develop during the pregnancy. Now, conditions which are pre-existent would include the age of the mother, like if it's a teenage child, teenage mother, or somebody older, like around 40, heavy weight, or pre-existing diseases like diabetes, hypertension, epilepsy, or even the previous pregnancy, if there were some complications in the previous pregnancy, like if the mother had a previous stillborn baby, if there was growth retardation, if there was a preterm labor, if there were lots of miscarriages. So all these would pose as high-risk factors for this present pregnancy. So what would be the conditions which can develop during this present pregnancy? This would be anemia, a very common factor, a very common problem in our country, which is often underdiagnosed. Then you can have diabetes and blood pressure which develops during the pregnancy, particularly after the 5th month. Or there could be growth retardation, a lot of fluid which is called lichorrhamni, too little fluid, conditions which might lead to preterm labor. So these are various things which can lead to high-risk factors during this present pregnancy.